Welcome back to Cecil TV. I'm Doug Donnelly. Tonight, my guests are Angelo Jaffes and Kathy Glace. Angelo is the Protect Coordinator for the Governor's Office of Crime Prevention and Security and Policy, and Kathy Glace, who is Executive Director of the Cecil County Community Mediation Center. They are here to talk about the CARE Coalition, which is the Cecil Assisting Reentry Coalition. And several months back, they conducted a simulation, and I will ask them to explain what that is. Angelo.
Well, thank you, sir. Thank you for having us today. The reentry simulation that we had was done first down in the office of the Governor's Office of Crime Prevention and Policy down in Crownsville, where my office is. We had a reentry simulation where there are 20 tables set up around the room, and we have participants come in, and we hand the participants a folder that provides who they're reenacting, what their job is, whether they have a job, whether they have money, and tell them that they are basically going to relive what an individual that has been incarcerated feels like when they come back into society. So my job at the Governor's Office of Crime Prevention and Policy as a Protect Coordinator, which is public resources organizing to end crime together. I went down to Crownsville and we participated in this reentry simulation, and I saw how difficult it was for individuals that have been incarcerated coming back into society. I actually was working one of the tables. I wasn't actually one of the participants, but you could still see what was going on with the participants in that simulation. So when I came out of the simulation, I thought to myself, this was eye-opening. I spent 29 years as a police officer with the Elkton Police Department. My job for those 29 years was to protect, serve, sometimes arrest people and take them to justice, as it were. My job, even in my field training program, my field trainer walked me through an arrest. We ended up going to court, and as soon as the judge found them guilty, he got up and he said, "Let's go." I said, "Aren't we going to wait and see what they get?" And our job is done. So my job stops right there. Afterwards, you just saw whatever difficulties they were going through as part of their penance for whatever crime they had committed. But I didn't realize how difficult it was. When I went to this simulation down in Crownsville, it hit me. One of the very basic things that we were having difficulty with is getting an ID. A lot of times people that are incarcerated, they lose a lot of things through either losing their lease, or I had one individual who was incarcerated tell me that when he got back out, his mother had been evicted from the house and they lost all documents. He had no way to get an ID. And when I came back from the simulation, the very next day, I started making some phone calls to see how difficult it was for somebody that had been incarcerated to come out and get a simple ID. You and I lose our driver's license. We go to the MVA. Now we make an appointment. We go to the MVA. We pay the $25, and we show our documentation, and we get another driver's license. To somebody who has been incarcerated, doesn't have transportation, doesn't have the $25, doesn't have the documentation, it's very difficult for them to be able to do that. So when I came back, I started inquiring as to how we do it, and that conversation led to a very pleasant woman at the Cecil County Health Department named Wanda. She told me that the county has set up some funds that they can pay for the driver's license in case they don't. She works to get their birth certificate from wherever they were born, and she facilitates them getting an ID. So I thought to myself, wow, that's great. Our county, very proud of our county. We have a way in order to help these people get over one of the very first hurdles that a lot of people do that have when they come back. But then I thought, why not have a simulation here in Cecil County? I contacted my boss, Mr. Richard Albin of the Governor's Office of Crime Prevention and Policy, and I said, "Hey, boss, what do you think about bringing a team up here so we can do a reentry simulation up in Cecil County?" He loved the idea. He jumped at it. So I started inquiring as to who I might be able to get to participate in this simulation and who could support it as well. So I reached out to some of the nonprofits, and I mentioned it in a health department meeting, separate entity altogether, but I mentioned that I wanted to do a reentry simulation. And to my surprise, they jumped on the opportunity. They were very excited about it. Why can't we bring that here? Let's see what we can do. And I started gathering up some more intelligence on who might be able to help. I mentioned it at a Hollingsworth Landing Association meeting where Kathy was involved in, and as soon as I mentioned the fact that I wanted to have a reentry simulation here in Cecil County, she jumped at the opportunity. And we worked, my team came up from Annapolis. Protect coordinators came from all over the state, Washington County, Anne Arundel County, down in Salisbury, Dorchester. Protect coordinators from ways away came to help me do the simulation. And on September 4th, upstairs at the Elkton Police Department, we had the entire thing set up where there was 20 tables across the room. You got a table for identification, the table for parole and probation, the table for a grocery store where they need to buy groceries, a table for a chance table where if they felt like they needed or lost their way and needed to fall back into their old ways, they had a chance where you can pick a card that says either you sold drugs for $1,200, you flip the card over, it either says go to jail or get the money, because they're taking a chance on the things that they do. The reentry simulation was, we had 47 participants, I think it was, that came, including teachers, lawyers, counselors from around several nonprofits. The health department had a lot of people there. The Chief Rogers was there, the sheriff was there. They were all intrigued by the idea of the simulation and what it could teach people and how we could bring awareness to the difficulties of people that are reentering society can encounter when they come back.
So, as a simulation, did it involve any actually incarcerated people?
I did ask 2 people that had previously been incarcerated very quietly if they wouldn't mind taking part of the simulation so that I can get an accurate account of whether or not our simulation was realistic. And I wasn't going to tell anybody who they were, but one of them stood up when we had conversations in between the participants, 1 week, 2 weeks of them living their lives as reentering citizens, who stood up and had actually introduced himself and said that he would have been incarcerated, and this simulation was right on point, which made me very proud that we had worked so hard and we actually pulled together with my team, Cecil Mediation, Kathy, the health department, CHEP, Communities Helping and Empowering Patriots, People, and Professionals came, and they also assisted us with that. They actually offered to buy lunch, because how do you get people to come to an event? You buy them lunch. They offered to buy the pizzas, and an interesting thing happened when we ended up doing that. They went to buy the pizzas from the pizzeria, Pat's Pizzeria. Pat's Pizzeria manager heard what the pizzas was for and donated them at no costs for us or for CHEP. CHEP is also a nonprofit that's doing wonderful things in this, but it saved them a little bit of money. They donated the pizzas for such a worthy cause. So on September 4th, 2024, we had the reentry simulation upstairs from the Elkton Police Department, and we started bringing awareness to Cecil County and all the above the organizations that I mentioned before. And from that, Kathy pushed forward. We ended up recontacting the people, and I'll let Kathy tell the story of how the coalition came to be, but we're both working hard for that coalition to exist and to expand on it. So please, Kathy.
Yes.
Thanks. So the reason we made the coalition became very evident at the simulation. What we found was by the end of the activity, was it about 75% of the folks that were participating had been incarcerated at some point through the process. So people in leadership roles realize how hard it is for people that are returning from incarceration to actually be successful on the outside. And we also identified that there's many barriers, systematic barriers within our community that's not intentional, but barriers nonetheless that cause recidivism in our community. So the national rate of recidivism is about 68%. So about 68% of people who are incarcerated end up back in prison within 3 years. In Cecil County, I'm very glad that the number's around 36%, but we can still do better. And what we learned from that simulation is that in a survey that was presented to everyone after the fact, we received that information back, we did some data processing, and what we found was that there were folks that had no idea that other organizations existed within Cecil County. There were folks that had no idea that there is a struggle for returning citizens and that they really need support, and that once someone serves their time, that it really is our job as community members to help them be successful so that they can become successful community members that work in the community, that live in the community, that pay taxes in the community, and that become productive citizens as well. So that conversation, that information led to all these folks saying we need to do something more, and that something more was the coalition. So rallying all these people together and inviting them to come out, let's see if we can come up with an idea of something that we can do, led to the coalition being established in November of 2024. And as of today, we've been working for several months, and we have about 70 members strong from the community. And yes, we do have folks that have experienced incarceration, family members of people who are or have experienced incarceration as well.
So you've begun processing.
So what we're doing
recently
is we
released people.
we actually built work groups, and we have 4 work groups currently working: transportation, agency collaboration, job skills and work ethics, and we just started housing. These are 4 of the barriers that are common for people that are returning, and barriers that were determined through another survey that are local barriers. And what these groups are doing is determining what resources are available in Cecil County, where is redundancy in resources, and also where are the gaps in resources. Our goal is to consolidate, collaborate, and get folks a coordination of care from the time they are released through that process so that they can be more successful.
Great. How are you looking for more people to be involved?
We are looking for more people to be involved.
And how can they become involved?
So the best way to get involved is to contact Cecil Mediation and just ask to be put on our distribution list, and you'll get invited to the next meeting. The meetings are held on the second Thursday of every month, 2 p.m., and we meet at the Elkton Presbyterian Church, which was now partnered with us, and I'm very excited to be in partnership with them. We meet on the second floor, so everyone needs to park in the back of the building and head up to the fellowship hall. We're looking for folks from really all sectors. We need professionals within the community that work with the returning citizens, and we also need returning citizens themselves and people that love them. It's going to be collaboration of all of these folks to really understand what the needs are and how to best meet those needs. And it's not going to be a quick solution.
Right.
But
how many people per week, or I mean, it's hard to imagine or get a handle on how many people are released from prison each month. Or
That's a difficult number to pin down. You get ones that have been incarcerated for a short time here at Cecil County that get released that don't have issues. You also have prisoners getting released from the other detention facilities around the state who get released and come back. And that number has been very difficult to nail down.
Right. Okay. So is it now, if they're coming back to Cecil County, is it you have a process in which this is made known to them?
we're working on creating that process.
I see. Okay.
So at this point, there are a lot of organizations and agencies that are working to support folks. We want to get a handle on a continuum of care that makes sense from the moment they're released, from getting a ride out of prison to getting into a safe space where the process can begin.
Right. And though, as we spoke, reentry mediation does not directly apply to this, I saw in my research that each session of reentry remediation, and I suppose that could extend to other forms of reentry contact, each session reduces the percentage of potential recidivism by 6% or something.
Actually, a study by Community Mediation Maryland found that with just one mediation session before release, there's a 10% reduction in recidivism. When there are 3 sessions before release, that number increases to a 24% reduction in recidivism. So the work that we do at Cecil Mediation is definitely part of our plan to give that wraparound care that folks need. As we know that our social systems are very important, and for people that are being released, the number one thing that they need, their resource, is somebody to care about them, someone who they can count on to be there through their
Right.
journey.
Right. Do you eventually expect reentry mediation to be part of this?
Absolutely. At this point, we do reentry mediation. We just don't mediate on the inside. But we do when we get a referral. We want to make a more robust referral system so that it can be just a part that is a part of the whole process, simply
Right.
because we know it works.
Right. Because certainly while getting a driver's license, getting a job, finding a place to live are all essential things, if your family's repulsed by you, or your wife has serious issues and grievances, you're going to have a hard time. 'Cause those are the
Absolutely.
people you're,
Absolutely.
while
So,
you're sitting there in your cell, that's what you're thinking about.
right. So the goal is to bring them together with people that they care about, to come up with plans of what that reintegration into the family and into the community is going to look like. Where are they going to go live? Are they going to go home? Are they going to a family member, a friend? Coming up with that plan before release is very important. And also really getting down to the nitty gritty of what it means so that everyone's on the same page. Because when, we've heard folks say, I thought everything was okay. My mom said I could come live with her for a little while, and it didn't work out. Well, a little while to mom was like 2 to 3 weeks, and this person coming out thought it was 6 months. So with mediation, our plan is to help them come up with solid plans so that everyone's on the same page, and with that agreement in place in which they can then work toward gaining employment, reintegration with the family. If they have children, what does that look like? And really helping them to get those relationships in place and get an understanding. And like you said, sometimes it takes some time in order to heal those wounds, but there is healing that can come through mediation.
Certainly. Okay. Well, Angelo Jaffes, Kathy Glace, we thank you for being here.
And thank you
Thank you
for
for
having
having
us.
us. Appreciate
Good
that.
luck with your project.
Thank you.
Thank you.